Hello dear parents, in this video we're not going to talk about your sick child, but about their healthy siblings. Because of course, their lives are also being quite shaken up by the cancer diagnosis of their brother or sister. And that's exactly why it's important to involve them from the start and to keep them in mind as well. Because as a family, you're all connected to each other, almost like by a ribbon. And the stronger this ribbon is, the more it can actually withstand, even when there might be a lot of external pressure added to it. But still, how do you manage to stay connected during such a difficult time? How can you also support the siblings as best as possible? And what do siblings actually need most of all right now? That's what we want to talk about over the next few minutes. And the intention is not at all to try to make everything somehow perfect. It's more about consciously thinking about what really matters most in your situation and what can be helpful to actually figure that out. So a good start is always to talk openly with one another. Just like with the affected child themselves, you should also talk honestly with the siblings about the cancer. Of course, without overwhelming your child, so in an age-appropriate way. Because the important thing is, the better the siblings understand what's going on, the better they'll also understand why their brother or sister needs so much attention right now. And they'll also understand that it has nothing to do with them personally. Younger children especially can quickly think that they themselves are to blame for things happening around them. That's why you should definitely make it clear that no one is to blame for the illness. And also that their brother or sister, of course, isn't sick because someone did, said, or thought something wrong. And another important topic is preparing siblings for the fact that their brother or sister might also change physically due to cancer and therapy. Yes, for example, because their hair falls out due to chemotherapy. That can be quite unusual at first. But if also the siblings know what's happening, it will be much easier for all of you to deal with it. And last but not least, a good conversation also opens a door for your child to talk about how they're doing, what they're thinking and feeling, or if they have any questions. So you see, talking openly about the illness can be the first important step to connect and staying connected with each other. The next point is that you don't just talk to your child, but also let them actively participate in this. What do we mean by that? Well, you could, for example, encourage your child to help out when you're packing the bag for the hospital. Yes, or you could ask if they'd like to paint a picture that you can hang up in the hospital room. This way, your child can contribute something and feels like they belong. That strengthens the sense of togetherness. If you're in the hospital for a long time, you can also let your child participate by setting fixed times when you talk on the phone or chat, for example. That creates closeness, even over a greater distance. Another important thing is one-on-one time, so actively spending time with your healthy child that really belongs only to the two of you, or to you as a group, however many of you there are. I know that's not always easy and not always possible, but that's exactly why it quickly becomes a habit to just let the child sort of tag along somehow. Yet, all children need the feeling of being important and being seen. Meaning, even if one child needs much more time and attention right now, the other shouldn't get the feeling of being less valuable. This one-on-one time doesn't have to be anything big at all. Yes, sometimes just a few minutes are enough that belong only to the two of you or the three of you, right? So maybe it can also help if you create fixed rituals or keep old rituals like the evening tucking into bed, reading a book, a short game. The decisive factor isn't how much time is spent together, but that your child feels now, in this moment, it's my turn. You can of course also get friends and family on board and ask if they can give your child an extra dose of attention. For example, by doing something nice with them, or picking them up from daycare or school every now and then. Sometimes it's also good for children if they are somewhere else, so not at home, but somewhere else entirely. Yes, so they can be the center of attention there. And get a bit of distance from the worries and problems at home. And that brings us to another important topic, namely, let others help you. You don't have to manage everything alone, and your children should simply get any support that is good for them. In many places, there are special offers for siblings of children with cancer. That can be organized trips, art therapy, or sibling groups where they can meet other children and young people who are in a similar situation. Just ask the psychosocial service at your clinic. They are very familiar with these topics and know about all the offers there for siblings. Another concept that has a special focus on siblings is the so-called family-oriented rehabilitation, where you can all take a longer break together in a rehab clinic after therapy. There, the siblings are also specifically addressed with their very own needs, what they want, and what strengthens them. By the way, we've also already made a separate video on the topic of different types of rehabilitation after cancer, which you can find here also linked on the page. Now, we've already discussed quite a few important aspects that can help to ensure connection and including your healthy children. Open, understanding communication, active participation, and one-on-one time. And we also talked about the fact that you should try to get all the support you need at any time, so that your healthy child also gets through this time as well as possible. And accepting this help is also a way to show that you care. So, and with that, we are already on the home stretch. Yes, but I have one last tip for you. Maintaining as much normality as possible for all your children. Sure, at the moment it feels like everything is different, but that's precisely why it's good if you preserve areas that remain as unaffected as possible. For your healthy child, life and everyday routine continue. At the same time, it's important that you inform the environment, like the school or the kindergarten, about the current situation. This allows the professionals there to better adapt to the siblings, if their behavior should change, for example. If they, for example, become very quiet, yes, or perform less than usual, and no matter what the relationship between your children is like, try to ensure that everything remains as it was before the illness. Even in situations where there's a real clash between the siblings, arguments are known to happen in the best of family, and these are of course completely normal and sometimes even necessary among all siblings. And it should be allowed to stay that way, because as I said, if the bond is strong enough, well then, you can be pretty sure nothing will really tear it apart so easily when it counts. And if you would like more suggestions and impulses now, then take a look at our other sibling videos for children or for teenagers. Or maybe you could suggest to your child that they take a look themselves. Yes, maybe even together with you. And who knows, maybe this will lead to a really nice bonding conversation.